Healthcare today can be said to be in the most flux we've ever seen. Part of this is driven by our increasing knowledge about the science of healthcare. And what does that mean? First genetic test directly available to consumers was released in 1996. Now everyone, absolutely everyone, gets their genetic code tested. By the beginning of 2019, more than 26 million people had added their DNA to the top 4 commercial health and ancestry databases. 26 million people took those tests. And at this pace, MIT estimates that we will have, within the next 24 months, 100 million people who've given their genetic information for healthcare. Just think about that, of what we can do with that knowledge and how the American Heart Association works to do that. The hope, right, is that as people are aware that they're at risk for diseases, they'll change their health behaviors. However, we can all change our behavior at any time. Some facts. Women take longer to go to the hospital when they're experiencing a heart attack than men. 54 hours versus 16 hours for a man. And why is that? Because our symptoms are of jaw pain, the nausea, the vomiting, sometimes fatigue, or we've got to find the right babysitter, or we've got to check everything at home. However, even when a woman finally goes to the doctor, she may not get an EKG because no one will believe that she's having a heart attack. So what's our first behavior? It's to know your body, to be your advocate. If something feels abnormal for you, it's abnormal, and absolutely no one should be able to tell you that there's nothing wrong with you. You demand an EKG. You have health insurance, or even if you don't, you ask for it. An EKG tells us if you're having a heart attack. So that's number one, and it is one of the biggest problems that we have in healthcare as cardiologists, where patients with symptoms are ignored. So that's my first behavior. But here's the second great one, and you guys will love this. Recent studies have shown women are 2 to 3 times more likely to survive their heart attack, wait for it, if their doctor is a woman. By the way, so the men don't feel left out, the same is true for men. Outcomes are improved if you're cared for by a female physician. So what's behavior number 2? Yeah, find the right physicians for you. If you have a physician who does not listen to you, I think I can own this one as a physician, switch, change. This is a team sport, your healthcare. So yes, women physicians have better outcomes. We believe, by the way, that's because women follow the guidelines for healthcare. Women go ahead and make sure they ask you questions about what's different for you. So it's communication, understanding scientific knowledge, and utilizing it to care for patients. But what if you knew your genes? What if your genes said, hey, you may be at high risk for heart disease? We've done lots of studies on this. Even if you have genes that tell you you're at risk for something, you still can reduce your risk of heart disease by doing what? Exercising, not smoking, and eating a healthy diet. You don't need me or a genetic test for that. You need to just manage your own health behaviors for all the good things that we all have going on in our lives. So I'm not going to go off tangent, but there's a slide here that I actually added in very recently. Smoking changing to vaping. I mean, seriously, when did vaping become a thing? It's a big deal. It is going to have an impact 10, 15 years down the road for us because we know so little. First, vaping-related lung injuries occurred several months ago. Hundreds of new cases in August and early September. 2 deaths in Oregon. CDC has said, until a definitive cause is known, persons should consider not using e-cigarettes. So please, no vaping, another behavior we can manage. So what have I said? You should advocate for yourself. If you think there's something wrong, keep fighting until someone takes it seriously. Know your doctor, find one who listens to you, and understand the risks that you have. These are all things that are within your control. These are all things that you can manage. But there's some things that you can manage that I think we don't think about in healthcare that much, and I want to talk about this a little bit. Today, in this country and in our communities, your zip code is a better predictor of your health than your genetic code. I'm just going to repeat that. Your zip code decides your wellness, your health, and how you will do in healthcare. So though healthcare is really important and receiving the right healthcare, where we live have greater impacts. Improving health and well-being in communities starts with ensuring the things that we all can do: healthy food, housing, jobs that provide us the resources necessary to care for ourselves. In essence, the types of things that prevent you from even needing to see me. Genetics account for only 30% of health outcomes. What I just described, we call them social determinants. They include behaviors and environmental exposure, and they account for about 60% of health outcomes. They're important. Take them seriously, such that if it's just income that you looked at, depending on your income, you will have a much greater risk of diseases. And that has to do with, is there accessible healthy foods in your communities? Are there physicians with the specialties that you need? And so you really want to make sure that you take into account the information of how you manage your health. I see a lot of people taking pictures. I will provide all of these to you if you want them, because they're really the things, right, when you think of American Heart Association, that you can take back to your communities as a volunteer and really make a difference. So I'll tell you a little bit about me. I came to the American Heart Association many years ago, and yes, youthful face, I'll tell you how long. But I grew up in a really poor neighborhood in Brooklyn and was always interested in becoming a physician, and by the luck of great high school counselors, got myself to college and really changed my own zip code. We always cooked really healthy foods at home. My mom's a great cook. But I quickly learned that the things that I wanted to do in healthcare, I could not do by myself, even being a doctor. I needed big guns, and the big guns are the American Heart Association. They do everything. They do research to find treatments and prevention for heart disease. They work in your communities, and today they're focused on social determinants of health. They truly are doing everything. So behaviors you can change. I'm reading this out for you so that when everyone leaves here, they have an action that they can go do. My team who's here sitting at the first table, shout out to Cambia Health Solutions. On my board, you know, everyone has a whiteboard in their office. Mine says fiber and water equals Zen. So we start with fiber and water. It's that easy, that important. Sleep, get active. If you've already gotten off on smoking and vaping, limit alcohol, particularly for women. Alcohol has a huger impact on women than men. And know your numbers. How many people here know their cholesterol, blood pressure, and glucose levels? All right. It's a lot of room for improvement, ladies and gents. That's an easy one to know. And if your doctor prescribed a medication for you, take it. If you can't afford it, I don't know, go on GoodRx. Ask your doctor to change it. Again, you are in control of your health. You can do all of these things for yourself. I've been a volunteer with the American Heart Association, wait for it, for over 30 years. We all, thank you. We all can make a difference in our communities. And I've worked with the American Heart Association every community I've lived in. So in case you can't tell, I'm from New York, but I lived in North Carolina, Philadelphia, and now Portland. And everywhere I go, the American Heart Association's commitment, professionalism, just a getting it done mantra is there. And so I am thrilled to be up here representing an organization that I believe is committed to changing all of healthcare. And they're not just working on heart disease and strokes. They're working to change our communities. You know, there are gardens and schools. I could give you the list, but for anyone who doesn't know the American Heart Association, I was an intern when I joined the American Heart Association, didn't even know I was interested in cardiology. Just that compelling, what do you want to do? I started out doing programs in hair salons for women to get them interested in heart disease. And the American Heart Association said, we'll support it, we'll fund it, go do it. There's another organization that I've joined in Portland, the reason I relocated here, which is Cambia. And I am thrilled and honored to represent them. In August, we, Cambia, were named a Healthiest Employer of Oregon for 2019 by the Portland Business Journal. We, Cambia, have supported the American Heart Association with almost $800,000. We've partnered with the organization for over a decade and over 4 states. Our cause and the American Heart Association mission lead to the types of behaviors we support. So if I could leave you with one thing, and do it for a woman you just met, one healthy behavior, it could be fiber, it could be water, it could be a walk, definitely no vaping, but really finding out how the American Heart Association in your communities and you can partner. That would have made this 10 minutes really worthwhile. Thank you, everyone.